Joining me today in studio, I have Dr. Jayson Stoffman. He is a physician who recently started working at the College of Physicians and Surgeons of Manitoba in their new restorative practices program. Jayson, thank you so much for joining me.
Great. Thanks for having me.
I would love to know right off the bat, what is this new restorative practices program and how will it benefit Manitobans?
Oh, it's a great question. So restorative practices program, we started 6 months ago officially. It's a different way of looking at conflict. The College of Physicians and Surgeons brought this in to support a new standard on practicing medicine to eliminate anti-Indigenous racism. So we want to address anti-Indigenous racism, other forms of discrimination in medical care. But the traditional forms of addressing those sorts of harms are punitive. So they go to the Complaints and Investigations group that investigates them and decides whether there needs to be punishment. The goal was to have a different way of doing it where we can educate and improve the system rather than just punishing people who haven't done a good job. So it draws from the principles of restorative justice. And I always describe restorative justice as an alternate way of looking at harms. So the traditional punishment approach is you've caused harm, so we're going to punish you. We're going to hurt you to show you that hurting people is bad. Whereas the restorative approach says, harms have been caused, harms create needs, and who's responsible for meeting those needs? And how can we as a community come together to help you meet those needs? So that's where restorative practices comes from, is instead of addressing anti-Indigenous racism or other discrimination by punishing and reprimanding, we give an opportunity for the physician or a physician assistant who's caused these harms to a patient to learn from the patient, learn from the family, and there can be healing on both sides. So instead of slapping a hand, we get to teach that one physician, improve that one physician's practice, and that can improve our whole system.
Fantastic. So it's going to benefit pretty much everybody.
That is the plan, and that's the hope. And in the 6 months we've been in existence, we've had some great discussions with registrants, with physicians. We've had great discussions with communities. We've met with communities, and we've had great conversations where we can sit down and talk about how these things are happening, how discrimination is happening, how it's hurting our patients, and how we can do better.
Fantastic. When did you become involved in restorative justice, and what does it mean for you?
So I got into this a couple of years ago. So I came to it through my work at the University of Manitoba. So I'm the program director for our pediatrics residency program. So I'm responsible for guiding the training of people who've graduated from medical school and want to be pediatricians. And this announcement came out for a restorative justice facilitator training. And I looked at it as a program director and said, this is a good tool I can use to deal with conflict with my residents. And I went through the training, and as I always describe it now, it became a new lens that I see everything through. I realized the potential impact for restorative practices in dealing with all these kinds of conflicts and all these interpersonal relationship difficulties. So that got me very involved in it. I was working on a master's at the time, and actually that guided my master's thesis, which looked at, could we use restorative practices to address professionalism problems in trainees? And again, the more I did it, the more I realized the potential of really making positive impact through restorative practices. So when the college was looking for someone to be part of this new program, I saw it. It was an intrigue, and they actually reached out because they had heard the work I was doing, and we had some great conversations, and I joined the program as the medical consultant.
Good fit for you, it sounds like.
Yeah, thanks.
So we're a Christian radio station, and as Christians, as believers and our listeners, why is it important to care about restorative justice?
Yeah. So, it's a great question. And I know when I was first looking at whether I would take this job, I prayed a lot about it. And what God actually gave me was Micah 6:8. As I was praying, is this something I should be doing? Is this where God needs me to put my talents and my efforts? And when I went to Micah 6:8, it's seek justice, love mercy, walk humbly, and I realized that's restorative practice. That's what we're doing in restorative practice. We're working in relationship. We're acknowledging we have made mistakes. We're taking that humility and we're seeking justice. So I think that was, for me, I looked at restorative justice in a different lens that way too, is that it fits with Christian teaching. It's aligned so well with that. It's also, the history of restorative justice as a movement is actually very heavily rooted in Indigenous practices. So it's, as I thought more about it and prayed more about it, I realized this is such a beautiful alignment of Christian imperatives and Indigenous practices, and it's just a great way of making a positive difference.
Now, you are trying to help, practices right here in Manitoba in the medical community, but anyone listening, just from your own opinion, what can listeners do to move towards this as well?
Well, yeah, I think this goes so far beyond just medical practice, and we've already had lots of opportunities to speak with other regulators in different provinces. We've had not just medical regulators, but other regulators. And there's a lot of excitement about the possibility of restorative practices. I've had conversations with Manitoba Justice, which has a restorative pathway within the Justice Department for, again, moving away from punishment to restorative approaches. I know the school system's been doing this for many years. So I think there's so many different places that restorative practices can be used. And, I'm excited what we're doing in the healthcare system is unique. We're the first regulator in Canada to be taking this approach. But I think it's something that can apply anywhere. And I love talking to people about it and kind of sharing what I know, sharing my passion for it, and just seeing the more we see the potential for other ways we can do this.
Fantastic. If there's anyone who's interested, or maybe specifically in the medical field, who just wants to learn a little bit more about this, is there any way that they can connect with you or this idea?
Oh, for sure. Yeah. I mean, this is where I always think I do have a LinkedIn profile that I occasionally will look at. So I'm on there. I think I'm Dr. Stoffman. I don't even remember my handle. But there is, we have an email at the College of Physicians and Surgeons. So it's restorativpractices@cpsm.mb.ca. And yeah, always email me as well. It's just my name, Jay Stoffman @cpsm.mb.ca. Always happy to talk to people and hear from people. And yeah, if I can help kind of bring these ideas into somebody's sphere of influence, I'm happy to help where I can.
Sounds like you are the right man for the job.
Oh, thank you.
Is there anything else you wanted to share today?
No, I don't think so. I really appreciate this opportunity to share. And yeah, like I was just saying, I love talking about restorative practices and kind of how they can be helpful. And the more I do it, the more I see the impact of it.
Fantastic. Well, thank you so much for taking the time today.
Great. Thank you very much.